Good evening, everyone. Guys, the World Health Organization could be just about to call a global emergency. Guys, if you've not done so already, can you please like and share my stuff and give it a subscribe down below? It really helps me out when you do that with the algorithm and gets my videos more noticed. Anyway, guys, so I was literally just got back from the gym. I was going to go to bed, but then I came back and I thought, wow, this needs to be talked about. For those of you who've been following the channel, I did a video on this a while ago, and it's about the monkeypox that is in the Democratic Republic of Congo. Now, I'm going to read you what it says on the article, and then I'm going to give you my comments on that, because, guys, if it's true what it says on the article, and I'm not saying it is, you know, but if it is true what it's saying on the article, this could be, well, if it's true what it's saying on the article, guys, and I don't want to make things sound out of context, but this could be, it could be a huge virus, almost like a global killer. So I'll put the link in the description, guys, and you can read this yourself. So monkeypox could be declared a global emergency after the World Health Organization calls an urgent meeting. The World Health Organization has called an emergency meeting in order to address the international outbreak of the deadly monkeypox virus. Since the current strain of the virus was first detected in DRC, Democratic Republic of Congo, in April, that's when we first started talking about it here, it has evolved to become even more infectious and deadly, killing up to 1 in 10 who catch it. Guys, that is 10% of the people who catch it. That is huge. When you think about other things that we were talking about, they've had like a 0 point something percent, fatality rate, probably even less. If this is right, this is huge, and this could be absolutely massive if this is declared. So I'll keep you guys informed on what's happening, and, just make steps to protect yourself and your family. Now the virus has spread outside the DRC, prompting the World Health Organization to call on public health experts to advise on whether the outbreak represents a public health emergency of international concern. So this virus then, it's obviously originated from the Democratic Republic of Congo, and as my friend says who works there, it's not democratic, it's not republic, no, it's not, what does he say? It's not democratic and it's not republic. Now, if people are moving in and around that area, and remember, this region of the world, this part of Africa, there's a lot of minerals being extracted from there, so you get a lot of movement in and around that area. Now, do we have people moving up through Europe, and could they be infected with this virus? I don't know, guys. That is my genuine, honest answer. What I would say, though, is, we need to start looking for signs and symptoms. We need to consider this and just keep this, not in our back pocket, but just at the back of our mind that this might flare up. And then like you do with your, like you do what we said with the public order, where you've got your hibernate, relocate, evacuate, you need to have good triggers, and you need to be keeping your eye on this thing, because the last thing any of us want, especially people who watch this channel, is these things to catch us off guard. So if you if you just keep your eye on this and make sure you're watching and you're searching for it, and certainly watching this channel, you can identify these triggers and make sure that you and your family have got good, procedures in place that can stop. Because look what's happened over recent years. When things go crazy, they go crazy really quick. And you always get the Karen factor. And what do I mean by the Karen factor? You get, the people in the supermarket who all of a sudden become experts overnight, and they're telling everybody what to do, and people are listening, and people are getting scared, and one thing escalates to another, and the next thing, nobody's got any toilet roll. The DRC is home to a densely packed population that frequently travels and moves across borders. And in the past month, at least 50 monkeypox cases have been reported in 4 other countries bordering the DRC. Burundi, Kenya, Rwanda and Uganda, which have not been affected before. So you can see the spread of this virus now into the neighbouring countries. And these countries, hang on. Yeah, these countries have not had infections before. So whereas initially it was isolated to the DRC, now it's in the neighbouring countries. And then is it going to be in the neighbouring countries, in the neighbouring countries? And you see how these things can spread exponentially. As with previous monkeypox outbreaks, the new strain predominantly affects men. Well, I'll let you read this, guys, okay? It's the promiscuous men. Promiscuous men. The World Health Organization Director General Dr. Tedros told experts his organisation was working with Africa's CDC and non-governmental agencies to understand and address the drivers of these outbreaks. So there you have it, guys. I'm just going to read you the headline from another Reuters article. African CDC likely to declare monkeypox public health emergency next week. I'll put these links in the description, guys, okay? Just for you guys to keep an eye on them. Make sure you read these articles, okay? If it's saying it, remember, if people are saying this in the press, in the mainstream like this, it's kind of already a done deal because they don't want to have egg on their face. So I'll read it again. African CDC likely to declare monkeypox public health emergency next week. So what does that mean? Well, if this thing becomes the new thing, then you can expect to see, measures introduced into the United Kingdom. Does that mean masks? Does that mean hands, face, keeping your distance, all that sort of thing? I don't know. But what I think everybody should do is just read about this virus, read how it's transmitted, read what the signs and symptoms are, so you can protect you and your family, because end of the day, guys, our own families, our own responsibility. So that's it, guys. I just thought I'd throw this quick video on there because this is something I do feel could be quite important, especially over the next coming weeks and days. And what we found historically in the last 5 years, what we found is when these things build up, the resources become fewer and fewer in the shops as people start to build up and get things from the shops and go and buy things. I can remember, there's certain keywords we can't say on here, but I remember back in 2020, I went to get a mask, a real mask, one with a rubber seal and, actual filters. I went to, where did I go? Like one of the hardware stores, I can't remember which one it was, and I went in and I was a little bit late. I went in and he said, no mate, they're gone, everybody's been buying them. So you can see there's a lot of people who are keeping an eye on these situations, and they're going to be buying up these, these items. I don't know what these items are, guys, okay? This will come out later if this emergency is declared, but I'm sure it'll involve some sort of PPE, some sort of, disinfectant, all sorts of stuff, I don't know. But like I said, guys, I'm going to put the links in the description. Make sure you give it a look, give it a read through and see what you think. I'll keep everybody updated on this because I have been following this outbreak for since April really, and it's one of those things that could go really big really quickly. And like I said, guys, when that happens, everybody's buying all the stuff, and literally shelves in the supermarket go dry overnight. Anyway, guys, that's it. I'm going to mag to grid. I hope you're having a great night.